Okay, let's do an internal, external rotation base class for our shoulder. Those that are struggling with an injury and can't get down on a yoga mat to do some of the bases. So let's get started. Okay, before we start the controlled articular rotation, if you're injured, you're not going to be able to get your full range and it might be painful in certain areas for our CARS. So your CARS is not going to look like mine. You're going to just explore your best possible motion. We're asking your body, what range do I have ownership over and active control? So just don't push it into any sharpness, move around it, but try to explore your best possible range in with your CARS. Okay, let's start off with shoulder CARS. Breathe in and radiate. Externally rotation, coming across the body, flexing up, find that roadblock, internally rotate and fight for internal rotation. Slow and controlled, step back, fight for external rotation, come down to that neutral position. Searching for our workspace, space that we have ownership of, really explore that. Do 4 reps on each side, that's 2. Coming up for 3. And last rep, 4 on this side. Sure we're not compensating any areas, we're just working the working joint there. Great, coming over to the other side, breathing in and irradiating, flexion, and then fight for internal rotation. Continue to internally rotate. Extend, now we're going into external rotation. Slow and control, just explore that space. That's 1. Two. Also making sure that we're going within the pain-free range. No pitching or sharpness. Three and last rep. Great. 4. Okay, external rotation base. This is my active range. I want to get in my passive range. So bringing this block here, coming down, and I'm in my passive range here. So let's set the timer for 2 minutes. We're going to be doing a 30-second Pails and rails contraction here, and we're going to alter the intensity according to where you're at with your tissue healing. So when we have an injury, especially when it's acute or inflamed, we want to be working in that pain-free range, maybe at the edge of our passive range there, and our intensity needs to be around 5 to 30%. And we just alter that intensity according to where we are and the feedback and sensations we're getting as we're doing these contractions. So you've got to be the coach so that these can be safe and effective intensity to help adaptation and tissue healing. So we've done a minute, another minute of the stretch. Concentrate on your breathing. Your exhalation needs to be twice as long as your inhalation. So we're getting into that parasympathetic state. So just breathing in and out, find the line of tension and getting that stretch there. Great, so we want to be within that 5 to 30% intensity for this contraction here. Our Pails contraction is going to be into the block. So I'll count us in, 3, 2, 1, and contract into the block. And we're going to build up to that 30% intensity. And we're just going to hold that 30%. If you can go a little bit harder, depending on where you're at with intensity, you can go into that. Just you be the coach. 3, 2, 1. Our Pails contraction is trying to make our hand lighter off the block. We want to go into that now. Make our hand lighter off the block. We're going to hold this contraction for 30 seconds. Ten seconds to go. Great. 3, 2, 1. Recovery mode. Get into a stretch for a 45-second stretch here. Great. How did that feel? Was the intensity appropriate for where you're at with your tissue healing? So just alter that intensity according to where you're at. And just breathe in and out into the stretch, find that line of tension. And I'll count you in for our Pails and rails contraction. Okay, 3, 2, 1, pushing into the blocks. Building up to that effort and intensity that you want to go to, 30%. Keep going, another 10 seconds. And then we'll switch to our rails contraction. 3, 2, 1, make your hand lighter off the blocks, contracting all the muscles into external rotation. Building up to that 30% contraction at the moment. 10 seconds to go. Three, 2, 1, and recovery mode again with a 45-second recovery mode. Find the line of tension and stretch. Great, 3, 2, 1. Okay, external rotation lift-offs. We want to lift off into external rotation and back down. We want to really squeeze and hold up into that external rotation, giving our nervous system and our muscles some experience in that external rotation in that range we've just opened up. So we want 10 reps, really slow and controlled. Nine and 10, we're just holding for 15 seconds, squeezing into that external rotation. Holding, keep holding. 5, 4, 3, 2, 1, and relax. Internal rotation base. Let's get into it. This is my active range. Let's get into my passive range. Pushing down, finding the line of tension and my stretch. And let's start our 2-minute stretch here. Great, breathe with this one. Breathing in and out. Try and relax and get into that stretch. Pain-free stretch here. Our Pails contraction is going to be pushing up into my hand. My rails contraction is going to go into more internal rotation. I'm going to push it down towards the ground. The intensity when we're injured is going to be according to how you're feeling, the sensations that you're going to get when you're doing the contraction. So we'll build up to where we're at there. But generally, when we're very inflamed and acute, we want to be in that 5 to 30% contraction in our Pails and rails. Okay, another 30 seconds and I will count you in for our 30-second Pails contraction. Okay, 5 seconds. 3, 2, 1, contract, building up to that 30%, slowly building up there. And then just maintain that intensity that you feel is safe and the effort that you feel confident in and the intensity that you feel confident in. Keep going, another 10 seconds there. Great, 3, 2, 1, swap that contraction with your rails contraction, pushing down towards the ground into increase internal rotation. I'm using my hand to create that resistance there. And again, building up to that 30%. Or wherever you feel you can contract to. And the intensity you feel confident with. Great, 3, 2, 1, and slowly release, going into that stretch again. And this is 45 seconds recovery and stretch. Find that line of tension again. Almost there. I'll count you in again. 5 seconds to go. 3, 2, 1. Our Pails contraction pushing up into your hand. Building it up to that intensity that you feel comfortable with. "30 seconds here, so we've got another 10 seconds to go. Great, 3, 2, 1, opposite contraction, rails contraction, pushing down into the ground, into increase internal rotation. We're pushing into that stretch and into our hand there. "10 seconds to go. 3, 2, 1, and bring it into the new stretch. Find that line of tension, breathe and hold, 45-second stretch here. Another 15 seconds. Great. 3, 2, 1, and slowly come out of that base. Okay, internal rotation, lift-offs, squeezing down into internal rotation, lifting up. 2, 3, 4, 5, 6, 7, 8, 9, and 10, and holding, squeezing down towards the floor in internal rotation. Keep going, holding. 5, 4, 3, 2, 1, and relax, come out of that.
Let's go to our capsular CARS. Bring our arms out into this position. Axial rotation, we're going to internally rotate. Squeeze that internal rotation and externally rotate. Internally rotate and externally rotate. Internally rotate, external rotate. Again, this is giving our nervous system some information, stimulating all the receptors around the joint, helping us to be able to get control and ownership of our range. And so we've got to stimulate our nervous system, get our nervous system to recognize that we can get into this range of motion safely, and that we can have active control in that range. Great, another 2 reps, internally rotate, externally rotate. Excellent, let's go into our shoulder CARS. 4 reps on each side, starting off with our right shoulder, externally rotating, breathing and irradiating, external rotation, internal rotation, fight for that internal rotation. Now, what range do we have ownership of now? What's the best possible range that we can get? Now, shoulder. 1. 2. 3. Explore that range of motion. Slow and control. What new range of motion can I get in that pain-free range? Good. Can we go to the other side? Breathe in and irradiate. Cross the body, externally rotating. Keeping that elbow nice and straight, no compensations. Explore what movement do I have ownership of in my shoulder. Two more. Great, and last one. Okay, well done.